numbers on a daily basis. That's not to suggest they don't matter. They absolutely do. However, what matters more are the actions we take, and that we do so consistently without interruption. Don't get too high when numbers are low. Don't get too low when numbers are high. We've all heard the extremely encouraging news recently about highly effective vaccines. This kind of thing appears no longer a question of if, but more a question of when. And the direction seems to support sooner rather than later. Here's what I believe. There is and will be an end in sight to all of this. That much I believe. For a long time, we weren't able to say that. Now I can. But what's also true is that we're not there yet, and we won't be there next week, won't be there next month. The finish line is in sight, but right now, for the next few months, we need to ensure all of us are healthy enough to make it there. That requires me, requires you, all of us to remain focused and committed, not just to the public health guidelines, but to each other. There's a path forward, and we're going to get there. And as we work our way towards that point, let's make sure we continue looking out for ourselves and each other and make sure we all get there together. Those are my thoughts right now. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. So a couple of heavy days here in Middlesex-London in terms of case counts. We've had 23 today, 21 yesterday. These are quite high. Anytime we're over 20, it's definitely numbers that are a huge workload for the health unit, but also an indication of significant spread in the community. Fortunately, another day with no new fatalities to report, so that's good news. A bit of a glimmer of hope in the provincial numbers, which seem to have stayed steady for the past 5 days or so. It's hard to, it's hard to imagine that we're saying 1,200 cases in Ontario is a good day. It's still twice the highest peak we had in the first wave, but seeing things level out at least for a few days is positive because they really have been climbing steeply recently. In the context of all of this, as you all know, the provincial government has implemented a new framework that puts in place specific restrictions at different levels of disease spread in the communities across Ontario. We were moved into the protect level on Monday, and that's where this Middlesex and London region remains at the current time. In that context of the new framework, we've done a detailed review of all of the orders and the one instruction to businesses that were in place here in London and Middlesex under the authority of the Medical Officer of Health and the health unit. And we're able to, at this point, withdraw 5 of those 6 documents. So you'll recall that back in the summer, we placed Section 22 orders on vehicles for hire and transit, and separately on personal service settings around masking. The mask orders are essentially covered now in the provincial masking guidelines, so we're able to withdraw those 2 orders. Since then, we also put an instruction in place for all businesses in Middlesex and London to mask anyone in indoor public spaces. That is now covered by the provincial masking regulation as well. So we're able to withdraw those 2 orders and instructions all around masking. On the 3 Section 22 orders that we issued about a month ago now, we had committed to reviewing those documents at the 4-week mark, and that is this week. So what will be happening as of Friday at midnight is 2 of those orders will be revoked, those being the personal services setting order around not providing services where an individual has to be unmasked to receive the service without additional protection. That is essentially completely covered under the new framework, Ontario framework, with us at the protect level. The other one that we're withdrawing for the same reason is the order around restaurants and bars. That is again covered now completely under the new provincial framework for at the protect level where we are, and where we certainly will be for the foreseeable future, if not higher, in the framework. So the third order that was issued 4 weeks ago, the order around sport and recreation fitness facilities, that order is mostly covered under the new framework, but there are some components that remain important, particularly around limits on team sports in terms of people on a roster and players on a field of play at the same time. Those have been in place prior to the framework across Ontario. When the framework came into place, they were only maintained for the higher levels of disease activity. So we're keeping that Section 22 order in place for an additional 4 weeks. And of course, we will review that order again at the 4-week mark. I want to take the time to thank everyone who is willing to come forward with their thoughts on those orders. We had a lot of dialogue over the last several weeks, conversations with people who are operating facilities, who are players, parents, all sorts of people who were concerned about business and or concerned about the spread of COVID. And those have all been very helpful in terms of coming to the place that we're at now. The sports order, part of the reason we're maintaining it in place is that the discussions we've had haven't indicated that the order that we have will place any additional burden on businesses over and above the provincial framework. Certainly the order, there were some, especially in the yoga community, who were concerned about the order that we had in place locally, but the provincial framework actually goes beyond that. So where we had, a limit of 12 to a class and 2 meter separation, the provincial framework Protect has a limit of 10 to a class and 3 meter separation, which is obviously more stringent. So withdrawing the Section 22 order wouldn't help that industry at this point. And it seems clear that the team sports have been able to adapt to the order. So, and in fact, there may have been a benefit to businesses. People are still able to get their team sports in, and you might, because of the limits on rosters, you might have actually seen an increase in the number of teams registering. So we don't see a benefit from a business perspective to withdrawing that order, and we do see potential downsides on the COVID-19 front. So that's why that one is being maintained. Otherwise, we're completely aligned with the provincial framework, and really happy that we have that document in place now to guide public health work across the province.
Great, thank you very much, Dr. Mackie and Mayor Holder, for those opening statements. We'll get to the questions right away. There are a number in queue here this afternoon. So we'll start with the first question. It is from Steve Young with CTV News and 1290 CJBK. It is for Mayor Holder. Mayor Holder, an anti-mask protest is scheduled for Victoria Park this Sunday. What's your message to the people that will be flaunting the mask bylaw in your city? Are you concerned about the potential health impacts as well as the impact on downtown business?
Well, hi, Steve. Let me be clear. These people want attention and recognition, and I'm not prepared to give them mine.
Sorry, my computer just froze, so sorry about that, some technical difficulties here. Thank you, Mayor Holder, for that response. Their next question comes from Steve Young with CTV News and 1290 CJBK. This question is for you, Dr. Mackie. What are your thoughts on this anti-mask protest and the fact that there have been a couple others in our region within the last couple of weeks?
Well, I think where I'm at on this sort of thing at this point, Steve. Unfortunately, this keeps coming up. I think the mayor has nailed the political issue. This is folks seeking attention for themselves. Masks are now very well established as an important control measure in reducing the spread of COVID-19. No one's ever said that they are perfect, but they definitely contribute to reducing the spread. And so anyone that is against that is essentially rooting for COVID-19 instead of for the health of the population.
Thanks very much, Dr. Mackie, for that response. Our next question comes to us from Jennifer Beeman with the London Free Press. It is for you, Dr. Mackie. Are our weekly stats, the London area case rates per 100,000 and percent positivity approaching the orange level restrict threshold?
Yeah, I appreciate the question, Jennifer. I would certainly say we're on the high end, if not approaching the orange level. For the case counts alone, the framework does have a number of indicators. So it's not just about case counts. They also look at percentage positivity and the capacity of hospitals, ICU, and public health in the region. And we're actually doing very well from those metrics. There are some patients in hospital, but the demand on ICU is pretty limited. And at this point, public health capacity is holding up. Our percentage positivity is actually very low compared to the provincial levels. And so it's not clear that we would be moved up in the coming days, but that is certainly something that could happen in the next few weeks.
Thank you, Dr. Mackie. And just a follow up to that from Jen Beeman with the Free Press, do you know when the province reviews the criteria that would determine which category a region is in?
Yeah, our understanding of the provincial process is there is a review by the folks in the Office of the Chief Medical Officer of Health sort of midweek. It's usually based on data from the previous week, which has been, standardized and assessed and made sure that it is, accurately depicting the process. Public health units can also submit any additional information if there really is a deterioration from that previous week. And we certainly did so, for example, last week when we saw those very high numbers over the weekend. And then the final determination is made either Thursday or Friday. And of course, because of the policy implications, my understanding is that those decisions all go to cabinet. So that seems to be the cycle for decision making, and it is happening on a week-to-week basis. My understanding is that a jurisdiction is quite likely, if they have a significant increase in cases, to be moved up. If the cases come down, they won't necessarily be moved down right away. We really don't want people sort of ping-ponging back and forth between different levels of protection. So they would certainly be up for a matter of weeks. Exactly how long isn't entirely clear.
Thank you, Dr. Mackie. Another question here from Jennifer Beeman with the London Free Press. Dr. Mackie, are you concerned by the recent number of LHSC staff testing positive for COVID-19?
Well, I think that anytime healthcare staff are testing positive, it's something to pay attention to. The reassuring thing from my perspective is that they've got an excellent occupational health and safety team at LHSC, and lots of, they're real leaders in terms of infection prevention and control. And so, when you see folks testing positive there, you can be sure that the hospital is taking that very seriously and putting measures in place to control any potential spread.
Thank you very much, Dr. Mackie. Our next question comes to us from Andrew Graham with Global News Radio, AM 980. It is a question for both Dr. Mackie and Mayor Holder. Ontario Health Minister and Deputy Premier Christine Elliott recently revealed that the province is set to receive more than 2 million doses of COVID-19 vaccines early next year. Does the MLHU or the Mayor have any insight into what London and Middlesex County can expect to see from that order? Have there been any discussions about that distribution? So Dr. Mackie, why don't we start with you and then over to Mayor Holder?
Sure. There's a national framework actually for prioritizing the groups that would be at greatest risk and or of greatest risk of spreading COVID-19. So that certainly is available. Identifies people that are elderly, people that have significant underlying disease, and people who work in healthcare that can potentially spread illness to vulnerable populations. And so, that framework will be very useful for prioritizing. Like is often the case with influenza vaccine, the arrival of the vaccine won't necessarily match the demand of, everyone to get it at once. And so that does become a logistical challenge to get it out as efficiently as possible, but also to make sure that it goes to those who need it most first. In terms of allotments, there haven't been any formal indications from the province of what our allotment would be. This region represents about 3% of the population of Ontario. So if you use that figure, you'd get probably a ballpark of the doses that we would receive.
Thank you very much. And Mayor Holder?
Thanks very much. I've not had a direct conversation with the Minister of Health, but I would imagine that priority would have to be given to those at greatest risk. And certainly, as the Medical Officer of Health has indicated, those with underlying conditions. But in addition to that, all of our frontline workers and first responders who deal most directly with the public, I would imagine those would be the first priorities.
Thank you very much, Mayor Holder and Dr. Mackie, for that response. We do have another question here from Andrew Graham with Global News Radio, AM 980. It is for you, Dr. Mackie. A video has surfaced on the Instagram account London Blog that was allegedly filmed inside the kitchen of Delilah's. The video appears to show staff without PPE and not physically distancing. Has the MLHU seen this video? And if so, which I don't believe we have, do we have any comment on that?
Yeah, I haven't personally seen the video, Andrew, but I can tell you that, you know, working without PPE, not physically distancing, I mean, we know these are risk factors for spread. So if that is happening, I wouldn't be surprised if it were contributing to the spread of COVID-19.
Thank you, Dr. Mackie. And just to follow up to that, Ashley Govias from the Western Gazette did have the same question. However, the follow-up is the health unit investigating the video, or would we be investigating the video?
Yeah, we're I mean, again, I don't think we have it yet. You folks often get these things before we do. So once we have it, we'll certainly take a look. Our role in the situation where there is an outbreak, as we've identified at Delilah's, is that, you know, we work with the facilities to make sure that they're safe. Whenever they can't demonstrate that they're safe, then they're asked to remain closed. And so, you know, that's the approach that we'll take here. You know, whenever that video is from, whatever it's showing, you know, you can be sure that those are the exact sorts of issues that we work with restaurants on. And again, this is a situation where in the vast majority of situations, everyone is doing their best. Sometimes we get people that are either lax or rushing or for whatever reason aren't following the rules. And it's our job to remind them, make sure that they are, and that's what we're doing in this case.
Thank you very much, Dr. Mackie, for that follow-up response. Our next question comes to us from Matthew Trevithick with AM 980 CFPL. Dr. Mackie, given the province is expected to unveil more restrictions in COVID hotspots in Ontario tomorrow, is the health unit anticipating further restrictions in London and Middlesex, such as a move to orange in the near future?
So, you know, again, this is a cabinet decision based on the ministry folks' analysis of data. We haven't had any discussions with ministry at this point, but, you know, the really helpful thing is that we have a framework. It is standardized, and decisions are being made by data. So, you know, when you look at those criteria, we essentially met 4 of the 5 criteria to move up to protect. Our percentage positivity is still quite low, but in terms of moving up to the next orange level of restriction, you know, we would only meet probably 1 of the criteria. So I don't know for sure what the decision will be, but again, we haven't had discussions about that.
Thanks very much, Dr. Mackie. And along those same lines, Steve Young from CTV News did have a question about the orange zone as well. And if you could see the Middlesex-London Health Unit moving into that orange zone as soon as this weekend.
Yeah, same response. And you know, I wouldn't speculate on how the provincial government's going to implement the framework here. Just to note that we're at sort of 1 of the 5 criteria being met at this point for moving up.
Thanks very much, Dr. Mackie. Our next question comes to us again from Matthew Trevithick with AM 980 CFPL. It is for you, Dr. Mackie. LHSC is now reporting 11 coronavirus inpatients in its care, 3 more than Monday, along with 15 infected staff members. Is there any insight the health unit can provide when it comes to how current hospitalization numbers compare to previous months?
Yeah, this is certainly the highest that we've seen the hospitalization numbers since the beginning of the second wave. In the first wave, as this moved through long-term care and in this region to a lesser extent retirement homes, you definitely saw high levels of hospitalizations and even ICU use, which we haven't reached at this point in London and Middlesex in the second wave.
Thank you, Dr. Mackie. Our next question comes to us from Matthew Trevithick, AM 980 CFPL. Dr. Mackie, have there been any additional cases linked to the workplace outbreak at Delilah's?
As far as I know, since the outbreak was declared earlier this week, there haven't been additional workplace cases linked to Delilah's.
Thanks, Dr. Mackie. Our next question comes to us from Leanie Lambrink with CBC London. It is for you, Dr. Mackie. There are 15 cases of COVID-19 among staff at LHSC, and another 55 are currently under investigation. What do you make of that? Do you have a message for healthcare workers?
Well, I mean, this is a sign that the hospital is taking those cases seriously. Under investigation likely means that either those folks have had close contact with positive cases or they have symptoms or are being tested. Again, all of that is a sign that contact tracing is working. Those people would be in isolation regardless of whether they're close contacts or they have symptoms. So again, for people who are going to be patients at LHSC, we're talking about a very low level of risk.
Great, thanks very much, Dr. Mackie. That leaves us with no more questions in queue for this afternoon. So thanks very much, Mayor Holder, Dr. Mackie, for joining us this afternoon. Thanks also to the viewers for tuning in and those who are listening and on the radio this afternoon as well. We will be back to join you on Monday afternoon at 2 o'clock for the next media briefing. So until then, have a great rest of the day and a great weekend.